Welcome to our podcast, One Flew Over Portable One. My name is Mindy.
I'm Naz, and today we'll be talking about mental illness and how it was treated in the past, how it was depicted in a novel called One Flew Over the Cuckoo's Nest, written by Ken Casey, and how mental illness is today.
So, Nazira, what's the first thing that comes to mind when you think of mental illness?
To be honest, the words that come to mind are unstable, dangerous, disabled, in need of help, and different.
Well, in the novel One Flew Over the Cuckoo's Nest, people with mental illness were seen as a mistake to society and was forced to be cured as fast as possible, no matter how painful the procedure was. The book was written in 1962, and the setting of the novel was at Oregon State Psychiatric Hospital.
Ken Casey, the author, was inspired to write this novel when he worked at the Menlo Park Veterans Hospital, interviewing patients there.
Yeah, and did you know that he was under the influence of LSD when he wrote parts of the novel? That's why so many scenes in the book seem so odd, since it related to how the author was feeling and saying while under the influence, similarly to the character Chief Bromden's hallucinations. So, Nazira, do you want to give the audience a brief summary about the novel?
Of course, so Chief Bromden, a schizophrenic Native American man who pretends to be deaf and dumb, is the narrator, and the novel starts off in the morning when a new admission, R.P. McMurphy, is brought to the ward. McMurphy plays the role of protagonist, and he stirs up the ward immediately. He introduces card games and gambling, and he encourages the patients to rebel against the rules set up and enforced by Nurse Ratched, who is our antagonist.
Can you tell us about procedures and services provided during that time period?
Okay, so electroshock therapy was the most common treatment for the mentally ill back then, and what EST does is it sends electric currents throughout the brain, and this intentionally triggers a short seizure. EST was thought to quickly reverse the symptoms of certain mental illnesses in the brain. It is still used today for those who are experiencing depression, but it's just a small shock, and the patients receive an anesthetic so they don't feel any pain. Totally how unlike it used to be today.
That's interesting because the procedure of ESD carried out in the novel wasn't as accurately portrayed in comparison to reality. In the actual EST procedure, it was just a brief seizure and lasted a few seconds. But in the book, Hardy explained to McMurphy that the patients wouldn't recover to themselves in at least 6 hours, and some would regain consciousness after 3 days.
Yeah, and also the EST treatment was given only twice a week to patients, but in the book it's mentioned that Chief Bromden received over 100 shocks while he was in the disturbed ward. It's funny because the patients in the ward were giving EST because they were misbehaving and not for any medical reasons. Not only that, but EST was not used for any specific illnesses. It was just a general treatment for all patients.
On top of that, from the article My Experience as a Psychiatric Patient in the 1960s, written by William R. Carney, who stayed at many different mental institutions, stated that he would receive 2 shocks per week, which is another source of evidence that the book's depiction of the electroshock therapy procedure was not accurate because, like you said, in the novel, Bromden had received about 100 shocks during his stay at the disturbed ward.
Yeah, that's pretty shocking, if you know what I mean.
I get it, but what could be worse than shock treatment?
Well, this procedure, which is actually pretty crazy, is way worse than EST. It's called lobotomy. So basically how it works is you use a sharp tool to drill holes through the skull, and this destroys tissues in the frontal lobes of your brain. They thought that by removing a section of the brain that was responsible for the mental illness, then that patient would be cured.
Oh yeah, lobotomy. And guess what? Antonio Igues Moniz, the person who invented lobotomy, won a Nobel Award for his invention of lobotomy. Crazy, right? Plus, it was stated that out of the 6 patients that he performed lobotomy on, 3 of the surgeries were successful and cured the patients and controlled their behavior.
Oh my god, no way. Maxwell Tabor was also given lobotomy, the character from the book, and according to the other patients on the ward, he became a new man and was an inspirational figure to the youth of their fine community, meaning that he was the only patient in the asylum who actually got cured and released back into society.
Yeah, but Mr. Tabor was not the same individual anymore. His brain was altered and his lobe was cut off. The society back then actually believed that he was healed. He was given an operation which changed the way he behaved and thought. Surely, he was emotionally and physically damaged by that operation.
McMurphy was also given lobotomy due to his actions of rebelling and bringing humiliation upon Nurse Ratched. His behavior caused him to become a vegetable for the rest of his life. I personally think that Nurse Ratched is abusing her power and isn't really caring for the patients, and she did this out of anger and frustration rather than out of love and care as a nurse.
Nowadays, the nurses and anyone that works in the mental institutions try to avoid physical restraint as much as possible while they are dealing with patients who are out of control. They try to calm them down through communication, and if it's not effective, they will send them to the seclusion room rather than performing an operation on them. This truly shows that Nurse Ratched is abusing her power and authority.
I know, right? I agree. And I really hate how she just controls her ward. So another treatment used back in the days for mental illness was drug therapy. The first drug introduced in the past was Thorazine, and it helped patients with anxiety, agitation, and confusion. The nurses and doctors believed that this chemical restraint was a more appropriate and humane way in curing the mentally ill, and it was, but it was also generally used, and since every person is different, the drug won't obviously work for everyone.
I agree that's a more humane way to treat them, but these medications didn't really help all the patients. And were they even aware of what substances they were taking? Like in the novel, Maxwell Tabor kept questioning what the pill was for and refused to take it without knowing what it was and what it did.
Unfortunately, medication in the past wasn't as advanced as today, so the patients were given drugs that might not even help them, but put them in more discomfort and caused extreme side effects. But the good thing is, though, that it advanced from that and continued to improve.
Yeah, extreme side effects on the patients back then can be compared to the whole situation between the characters, Seinfeld and Fredricksen. One wanted a double dose of the medication so his seizure wouldn't occur as often, but the other patient didn't want to take the drug because it was making his teeth rot.
Drug therapy was pretty successful and a good step towards treating the mentally ill because that meant less EST and lobotomy.
That is true, and in today's society, medication is obviously way more advanced, and each individual patient is cared for differently and are given the appropriate medicine rather than the same pill for everyone. Medication helps reduce their symptoms, but it does not cure mental illness alone. In order to aid patients with disorders, medication and therapies must be combined for an effective treatment.
Talking about therapy, there are many different kinds of therapy used today to help the patients, like family therapy, psychotherapy, group therapy, and cognitive therapy.
Chief Bromden was diagnosed with extreme schizophrenia and paranoia, and he was treated with EST and unknown drug substances. But in the present day, he would have been treated with confidential counseling like cognitive behavioral therapy. At these therapies, patients are learning how to neglect all the negativity in their lives and learn how to think positively. By thinking positively, they will slowly change the way they behave in that their emotions and beliefs influences their actions. So Nazera, how is this different compared to the novel?
Nurse Ratched had group meetings in the ward as well. However, her approach on these therapeutic meetings were to stimulate fear into the patients and establish her power and authority. She also received entertainment from these meetings because she would force the patients to confess their embarrassing actions and unforgivable acts during the group sessions.
What a terrible person. I personally think that this novel was written to bring about change to people's way of thinking, specifically the mentally ill. If I haven't read the novel, I would have still seen the mentally ill as extremely different from regular people, but in reality, they are just like us.
Yeah, same. And I expected them to be treated properly with care because, it's a hospital, right? That's what it's for, to, properly care for and treat for the patients. But it was quite the opposite. And now that I think of it, isn't this, a satire?
Yes, you're correct. It is satire, and what it is a technique used to criticize and expose corruption of an individual or a society by using humor, irony, or exaggeration, and it's meant to bring about change.
The novel satirizes mental institutions and the negative effects it had. It shows us how the institutions were and the procedures and care they performed on the patients. Treatments and medications were more damaging rather than helpful because either the same treatment was used for everyone or the medication would not have anything to do with a person's illness. General medication for everyone isn't really helpful because each person would be going through different illnesses and everyone is different.
And a lot of the patients were actually as ill as we thought to be. They think and act like regular healthy people. A number of them were voluntarily because they didn't have enough confidence or couldn't fit into the expectations of society. They were mistreated in the hospitals and not seen as people. Like, for example, the excessive shock therapy, procedures not carried out properly, and activities forced upon patients.
I thought it was pretty ironic how Nurse Ratched, a woman, had all the authority considering the setting it was in, because like people were more sexist in the 60s than they are now, and like in society they thought only men were meant to possess the power, but in the novel a woman runs the hospital.
Yeah, that's true. And I noticed a lot of racism in this novel too, like especially towards the black boys. In the novel, it was mentioned that the blacker the black boys are, the better they are at cleaning. This clearly shows that the black boys are not being appreciated by society due to their dark pigmented skin. Also, the fact that they had such a low status in the ward and their bitter attitude towards the patients shows the possibility that they most likely had a rough time growing up due to their skin color and their lack of education because of the racism revolving around them.
Yeah, true, I agree with that. And there was also like racism towards Chief Bromden as well, because like on the morning of the fishing trip, one of the staff members called him illiterate just because he was half Indian, and it's perfectly clear in the novel that Indians are portrayed as illiterate. Bromden like represents the Indians as imprisoned at the mercy of white people. So Indians, like Bromden's father, were forced to give up their land to the government, who were white. Their land was important to them, and being forced to hand it over was like giving up their freedom.
It's honestly sad how racism still exists today and the amount of discrimination minorities receive.
Yeah, it really is sad. Some people are just ignorant and very close-minded. Society back then believed that if you were diagnosed with a mental illness, then you're automatically seen as someone who's dangerous and different and all those negative adjectives. Fortunately, today, they are treated more properly and aren't seen as animals anymore by most people.
Well, I think that sums up our discussion on the novel's depiction of mental illness, diagnosis, and treatments presented in comparison to how mental illness is dealt with in present-day society.
We hope that you learned a lot from this discussion and your perspective on the mentally ill has changed into something less negative, and hopefully you see them as regular people who are going through internal struggles.
Bye.
For listening.